All right, Terry. Well, you might remember this picture of a little boy with leukemia being comforted by his sister. This is Beckett being comforted by his sister Aubrey. And the now viral photo out of North Texas shows the reality for families with children battling cancer. And childhood cancer is what we're talking about in our What's Going Around segment. Dr. Muaz Alrazzak, pediatric oncologist at Palm Beach Children's Hospital, joins me now to talk more about this. Thank you for being here.
Thank you. Thank you for having me.
What is the most common childhood cancer?
Well, acute lymphoblastic leukemia remains the most common childhood cancer. It accounts for about 1/3 of the cases, the whole cases of childhood cancer.
Talk to me about treatment, too, how far it's come, even breakthroughs in the last 10 years.
I would say that the targeted therapy has been merging very well lately. It's mainly an immunotherapy or molecular therapy that is designed to attack only the cancer cells. With that, those therapy will be having fewer side effects and better successfulness rate.
Looking ahead to, what does the future hold? I feel like that's the question so many people with loved ones that are battling cancer asking, what's ahead?
Well, like I said, the progressing targeted therapy is the most important and the most hope that we have, that we hopefully could utilize it for more cases in childhood cancer. It's being utilized more in adult cancer, but we are hoping that we can expand that more in children cases.
How are children treated differently from adults?
There is many difference in the treatment between children and adult. First, it comes to the etiology behind the cancer. Many adult cancers are related to lifestyles and environmental factors, while it's not the case in children. The second difference is the chemotherapy in children is well tolerated. They have usually less health problems, and their organs can tolerate the chemotherapy better, leading to better successful rate in the children cancer treatment. On the other hand, the clinical trials and the new emerging therapies start usually in adult population and move in to be used in children population.
Doctor, what do you make of that photo? You saw it's gone viral. It's just been seen by so many. A parent wanted to show that when a little one, a loved one has cancer, it can affect the whole family. The sibling is right there with her brother. I know you come at this from a medical perspective, but what do you think when you see that photo?
I mean, it's very sad. Honestly, it's showing the other picture of children cancer. This is what the family being through. This is how they're dealing with. It's not just a treatment. It's a lot for the family. Even when we talk about simple cancer, let's say like we're treating a child with leukemia in maintenance therapy, where they only take the pills at night and they comes once a month to the office to get chemotherapy. That's still a lot for the family. And this is what we're seeing. We're seeing actually the other picture of childhood cancer. It's not a smiley child who just lost his hair or just been vomiting once a day or twice a day. It's much more than that.
Yeah, the mother had very specific reasons, too, for putting that photo out there. She said she wanted to raise awareness and kind of bring some of those hard truths that you just described to light. So, Doctor, thank you so much for being here.
You're welcome.
Really
thank you for having me.
Sure.